of the Vein Institute, and I was telling you, remember my legs. So
I remember your vein.
I had that ginormous asparagus vein popping out, coming from outer space or something, and Dr. Hajbian fixed it. But we're talking today about what if you don't see a vein? What if you have some of the symptoms, which would be throbbing in the legs,
aching,
pain,
cramping, dull ache. After your workouts, your legs may ache. During your workouts, your legs may ache. You get cramps. Those are all symptoms of venous insufficiency, which is the disease that causes varicose veins.
Right.
So what's your next step after you have that and go see you and say, this hurts and I can't see where these veins are coming from?
If you're having those symptoms and we determine that it's a venous issue, then the next step is an ultrasound study of the legs.
Yeah.
To find the areas that are damaged within the veins, the valves not working, and then we move to treatment after that.
Because I bet there's a lot of people that have all those symptoms, but because they don't see a vein, they don't equate it that it goes actually with the vein.
That's right. So a lot of people attribute a lot of these things to age or, you know, I worked out too hard and things like that. But, you know, when you're working out consistently or when you're sitting around, you shouldn't start experiencing those type of symptoms in your legs in the average person. That's
what do you
not
do
normal.
for the varicose vein? Once if you identify it or you see it or you just hate the way it looks, how do you get that thing out of there?
We don't do surgery. That's what we don't do. We treat the veins with lasers. We treat the veins with injections, where we use ultrasound to guide medicine inside the veins or use a laser fiber to close the veins.
It's super simple. I mean, literally, they go in and you just have a little chat. They're just talking with you. It's super simple.
Well, and yours is totally gone. I mean, that, so the vein is treated.
Treated, and then it gets
absorbed. And you don't have any
absorbed.
cuts or anything else? I mean, that's so nice.
No, in fact, you can do it without any cuts. Patients walk in and walk out. Very little downtime. 95% of my patients, it's an ibuprofen level kind of discomfort afterwards.
I mean, you get up and you walk around. You walk around to get the circulation, all that kind of stuff, and you drive yourself home.
That's right.
What about people that have veins that they can see? Should they come in and see you?
If they have visible varicose veins, it's already time to be seen for that.
You need to go in.
Yeah, you need to do something about those because with time, this is a chronic disorder. So with time, you're going to start having symptoms. You're going to start having problems. 70% of open wounds on the ankles are due to venous disease.
Oh my gosh,
Wow.
and they don't go away. I mean, this is an issue. It's not going to go away, right?
No, it's a chronic disease. You want to keep an eye on it. Even those who've had treatment in the past, they may get some recurrence over time. The old way of doing surgery had a very high recurrence rate, and the newer ways have less of a recurrence rate.
Well, and you just feel so much better about yourself when those veins are gone.
You know, your legs feel better, you're more confident, you're walking around with more energy because the blood's not pooling in your legs, and you just feel better.
I will tell you that my 10-year-old he used to push it.
Mrs. Pushing
So now he's bored. He has nothing else to do. Now he's not pushing your veins.
Well, now he likes to play with the fat that hangs on the back of my elbow. You have a screening coming up, right?
Yeah, we do. We just had one. We have another one coming up on May 8th. And we actually have two, I believe, in May. But this is the May 8th one.
This is the soonest one.
The soonest one, yeah.
Hey, it's free. Just go on out there and let Dr. Hajbian look at you and give you a little, you know, tell you what's going on. I think that's wonderful.
You might have to go check out my legs after the segment. We have to go look.
Come on in.
I'm not tan, so you could see the veins, I'm sure, really easily. Thank you so much. It was nice to meet you.
Coming back. All right. Any more information you want on Dr. Hajbian and the Vein Institute, we'll have it on our website at forutah.com. Glenn, what's up next?
All right, up next, Katherine Heigl is not happy with a certain drugstore, and the fights over this picture